How are you guys? I was just messing around with my screen thing here, trying to see if I could somehow decrease the glare from my computer on my glasses. And I can't figure it out. I think probably I need no glare glasses, which ain't gonna happen. So we just have to deal with the glare. That's just the way it is. All right. So we are talking this week about the condition known as neuropathic pain. And on Tuesday, I went through the physiology of neuropathic pain and what that actually means. We talked also about the conventional treatment approach to neuropathic pain and what that looks like in terms of medications. But now we're going to move on to my favorite topic, which is plant medicine. So, um, you know, is plant medicine a benefit in the setting of neuropathic pain? Well, we do know from existing studies that cannabis has properties that actually protect the nervous system. So it's called a neuroprotectant, which means it protects the nervous system. And it's also an antioxidant, which means it removes oxidative stress, removes free radicals from the system that can lead to pain and other problems. And it's also a pain modulator. So this is really important because it can actually result in literally restoration of damaged nerves in some situations. Now, not everybody is going to experience that. It depends on how significant your injury is and if there's been surgery, and there's all kinds of other factors that have to be factored in. But there have been studies that have shown that it leads to complete resolution of damaged nerves in some situations. So it's going to decrease inflammation, going to remove that oxidative stress, and help control pain. So in clinical trials, there's a statistical analysis that's known as the number to treat. And basically what that means is that out of so many patients, you want it, in order to get a positive response from whatever treatment it is that you're doing, out of so many patients, then that's going to mean that that many number of patients are going to be having a positive response. I know that sounded really crazy, but let me talk about it a little differently. So let's just say I'm taking my shoes off because I'm having a hot flash, as you can probably see, stinky hot flashes. But anyway, so let's just say that you're a provider and you've got a patient and several patients that need to be on statin medications for cholesterol. So in a person with cholesterol issues who takes a cholesterol lowering agent like a statin, the number of patients that have a positive response in terms of reducing risk of heart attack or stroke is 200. So in other words, you'd have to see 200 patients for one person to have a decreased risk of heart attack or stroke while being on a statin. That's not a very good ratio. You want it to be a lot better than that. Well, guess what? Guess what, people? In the case of using cannabinoids to treat neuropathic pain, the number of patients to treat to result in an improvement or complete resolution of symptoms is, drumroll, 5.6. So you would have to see 5 points. Out of 10 patients that you see, 5.6 of those patients are going to have a relief of symptoms. Now that's a really significant finding. So how does this even work? And we go back to the good old endocannabinoid system. This system occurs naturally in our body. It occurs in an attempt to create balance or homeostasis within our cells. And that's the endocannabinoids that we make. That's your 2-AG and your AEA. Those are endocannabinoids. The CB1 receptors that live in the central nervous system and the peripheral nervous system are activated by your endocannabinoid system. And this results in modulation of pain or pain control. The CB2 receptors, and this is all part of our endocannabinoid system, our receptors, CB1 and CB2, and there are others too. There's one that's like TRPV1, I think. But the CB2 receptors live in other structures that are like particularly monocytes, which is part of your blood cell line, your red blood cells and your white blood cells and all that stuff. So the CB2 receptors live in monocytes and mast cells, which are all associated with inflammation. So when these receptors are activated, there's this cascade of events that occurs in the central nervous system and the brain that results in a decrease in pain and inflammation. So if you reduce inflammation, you automatically have a reduction in pain because inflammation causes pain. Other newer discovered receptors are activated as well that will help with that pain modulation, and that's that TRPV1. So it should be noted that all forms of cannabis are currently illegal in many parts of the world. And as a result of that, obtaining these products can be very difficult and may not be legal in your area. So you got to really check and make sure. If you're considering using CBD or cannabis for neuropathic pain, please make sure you talk to your healthcare provider first, and they can help you weigh the risks and the benefits before you make a decision about that. I will be moving on and talking about how, like, maybe give you some examples of how you might dose cannabis if you've got neuropathic pain, like we've done in other videos. So we always talk about, are you going to smoke it? Are you going to use smoke a joint or a pipe? Or are you going to dry or vaporize it? Or maybe you're going to use an edible, or maybe a tincture or an oil under the tongue, or maybe a topical approach. So we will talk about that. And then I also want to throw in some suggestions for essential oils that you can use because, hey, I have been using my one essential oil that I get. I actually forgot I had it. I can't believe it. But I've had this toe that I got operated on last November. I had to have surgery because I had developed some osteoarthritis, and from that osteoarthritic joint, a little thing called an osteophyte was formed. Well, that osteophyte broke off, and so it was just floating around in the joint space there, and it was actually hitting a nerve and causing excruciating pain. So the surgeon went in, removed that osteophyte, kind of cleaned up the head of the joint, sewed it back up, and I thought, yay, I'm good to go. Well, no, that pain was gone, but then I had post-surgical pain. And I'm thinking, here we are, we're coming up to a year of this pain, which has been off and on fairly excruciating. So it's mainly a numbing pain. Like my toes just numb, which I expected because, anytime you cut the skin, you're going to cut little nerve endings, but, you want those to regenerate, and they should. So my toes been pretty numb. And then sometimes it's like, why did I even go through surgery if I have this pain? This is terrible. So in the last few weeks, I've done a few things. I've got a little regimen. One is this watch that I told you guys about in a previous video. This thing is pretty cool. So I put it on paresthesias. I've used that setting. I've used the numbness setting. And I don't do it every day, but I've done it a lot in the last couple months. And then I use a CBD gel and a CBD salve. I mix those two together, and then I use my Panaway essential oil and mix that in, and then I just put it on my toe. Well, in the last 2 weeks, there has been a significant turnaround. I mean, something's happening in there. So I have, if I was to rate the numbness on a scale of 0 to 10, like what it was, and let's just say it was like an 8, it's now about a 3. I mean, it's still numb, but it's much, much improved. And then the actual pain in the toe, because I think it's a lot of inflammation. If I was to rate that pain on a scale of 0 to 10, probably stays like around a 7 or so, and now it's about a 2 or a 3. So I'm very happy with that. I was gonna go back and see the doctor again and say, what the heck. But I don't think I'm going to have to now because I believe it's getting better with this regimen that I'm using. So with anything that's dealing with nerves or inflammation, nothing is going to get better overnight. I don't care what you do. But this, using plant-based medicine, I feel much better about that than, I don't want to go take a bunch of ibuprofen or Aleve or Tylenol. I will if I have to, but I would rather not, and so I don't. But I'd rather do this and just give it time than to try to find some quick, resolution, and then maybe possibly have to deal with side effects of medications and stuff. So, anyway, moving on. That was a long explanation. I'm going to be talking more about oils that you can use, and then also the not specific dosing, but some generalized recommendations for how to use cannabis and CBD in the setting of neuropathic pain. I also write a blog that I include most of this information in. If you're not getting those blogs and you want to see the blog, because maybe it's just easier to read, then please let me know and we can get you on my email list and get those blogs out to you. Last thing, the Facebook group Menopause Mary Jane and Other Things, I'm going to be archiving. The last date that group is going to be open is going to be October 31st. So, I've already had several people reach out. Thank you so much for letting me know that you want to go into my other group. So my first group that I'm moving people into, if you want to go join us over there, is Brain Body Oils and Medical Cannabis. And that was actually the first group that I started after I started using essential oils. So there's a lot of information in there, pretty much from several years ago. So you can go dig around in there and see if there's anything that's helpful to you. But anyway, if you're in Menopause Mary Jane and Other Things and you want to go with us over to Brain, Body, and Oils, let me know in the group that you would like to do that, or you can private message me. That's fine too. And I'll add you to the Brain, Body, Oils, and Medical Cannabis. So that is it for this Thursday. Have a great rest of your day. See you later.